Well, hi, it's Paul Fulreader, Editor-in-Chief of Dentistry today. And I met a new friend today, Dr. Ali Fulreader. Did I say it right?
Yes, you did.
You're in the Chicago area, I believe.
I am, yes.
And Ali has a very, very digital practice, which is what we're all striving to do. She has like everything and all this stuff, all the cool stuff.
We've got some fun toys.
And so we want to focus here a little bit more on, we all know about scanning the teeth and all this sort of thing, but let's take this all together and show how it can work for orthodontics. So let's go backwards as a GP, plain old GP. The patient's in the chair at hygiene. You come in to do a check and you're looking over. Something's off here. And you say to the patient, you could have braces. And they go, oh, I'm too old for braces. So what kind of reaction do you get to things like that?
So we get a lot of that. We have a highly aesthetic practice. We're in the North Shore of Chicago, and a lot of our patients are open to the idea of aligning their teeth, but don't want metal brackets. So we do talk a lot about clear aligner therapy, the benefits of it, the ease of it, how you don't really notice while you're wearing the aligners. We have a lot of patients that end up moving forward with treatment.
So in the old days, which isn't that far old, you'd say, okay, so come on in, we're going to slap this stuff in your mouth and take impressions and all that, and you're not doing that at all, obviously.
We're not, no. So we have a digital scanner. We use the Prime Scan. And in a minute or two, our hygienist or assistant or even one of the doctors can go ahead and get a scan, show the patient where the teeth are. And we try to be very visual in our practice. We use a lot of digital photography, a lot of scanning capability, just as a means of communication to our patients. And I found over the years, I've only been practicing 11 years, but it really is a meaningful way to communicate with patients when they can see what you're actually seeing.
Well, it's so abstract. If you use an intraoral camera and say, you have a broken filling in number 13, they go, where is that? And then you have the whole arch sitting on there, you can move it around and say, this is this. So in terms of the orthodontics, can you do a prediction of what's going to happen?
Yep. So there's a simulation. Once we take the scan and take photos of the patient's teeth, we can actually do a digital simulation and show them where teeth are now and where they're going to be. One thing I love about the SureSmile software is there's a toggle button where you can show them the superimposition of start and superimposition of end. And like you said, very powerful when patients can see the actual change that's happened with their teeth from start to finish.
So how complex is it for you to do you have to design the case, or is they help you with that, or how does that all work?
No, you don't. So there's an option to do that with the orthodontic software. You can do what's called a DIY case, where you're moving the teeth, then the aligners are staged, and you can do it all yourself. Patrick, our rep, has actually helped me quite a bit do that for smaller movements.
Okay.
The other option is just to have that outsourced, and the digital team can manufacture where those teeth are going to be placed, and then you can alter any way you want the proposal and where you'll end up.
And then you have this before and after, and you have, let's say, 12 steps or 15 steps. What happens in the middle, like at step number 7, you go, oh boy, something's wrong here, we have to do it. Can you do corrections too?
Absolutely. So you can do a mid-correction, just taking a new scan, sending that out, getting some new aligners. I've actually found that our tracking is really, really good with the newer technology, both the aligners, the way they're cut, and then some of the other devices that are particular to SureSmile, like the V-Pro, have really helped our aligners with their tracking.
So you let the cat out of the bag. Let's talk about it. Let's talk about it. So there's an option that you have called the V-Pro, which is what do you explain?
Yeah, so the V-Pro is a vibration device. The patients put it in their mouth for 5 minutes a day with the aligners in, closed down lightly, and those vibrations can cause the teeth to move in a more efficient, effective manner. Takes our patients from wearing their aligners for 2 weeks at a time to 1 week at a time.
Wow.
And the tracking's really, really, really good. So I'm finding way less mid-course corrections like we spoke about earlier, way fewer refinements. There was a 3-year study that SureSmile did that showed that there were no refinements in 75% of their cases.
That's a lot. That's a few. A lot of them, not a lot.
Yeah, exactly. And they have a long track record. So over 1 million patients, I think they've treated in the past decades that they've actually provided treatment.
Wow.
Yeah.
So it's a proven system. It's not just off the shelf somewhere.
No.
I'm just curious, can you use those trays for whitening at all?
You can use the trays for whitening.
Yeah.
Usually that's how I have my patients whiten, is just in their aligners, and it works really well. It doesn't get all over the gingiva with the hydrogen peroxide, so it works really well.
I have a hard question for you. You said you're using the Prime Scan. What if I don't have a Prime Scan? Can I still use SureSmile?
You can still use SureSmile. part of the reason I actually personally started using SureSmile more and more is that it's an open platform. So any scanner will be compatible with their software. You just upload the STL to the SureSmile platform with your photos, and you're good to go.
That's pretty good.
Yeah.
Now, what kind of response do you get from the patients when they actually see what's going on, what happens, and how many hugs do you get?
Yeah, I mean, I think they're pretty blown away with the capabilities, especially in a short amount of time, what we're able to do and how we're able to move the teeth, and how we're able to generate a more balanced, even functional occlusion. We spend a lot of time looking at occlusion in our practice and kind of explaining to patients the benefits of correcting a malocclusion. I think it's 2/3 of patients in the U.S. have a malocclusion of some sort. And I think personally it's one of the most underdiagnosed things in our existing patient practice.
There's also so many health benefits. We say, oh, my teeth are a little crowded. Well, yeah, you can't floss. You got the hygienist has to work harder to get around those areas. And when they're finished, they go, oh my God, I can floss them. The scaling is easier.
Absolutely.
That's a part of this whole thing.
For sure. And we know that the teeth move forward and down as we age. So that's another piece I'm talking about a lot with my older patient demographic is where are we going? Right now we're healthy, but where are we going 10 years, 20 years, 30 years from now?
Just one last question. I really didn't think about that. When you first send this case out, do you have any input to that? You said this is DIY, but who are these specialists to help you with? I mean, how do you get in touch with them and what do they do? And they talk to you about it?
So that piece is probably a bit more esoteric for me. There is a helpline that's readily available, but the treatment plans that are generated usually takes about a week or so to get the proposal back. And I usually just make notes in the chart, and then if there's anything that I want to correct, I do it again, and usually have the case back in a couple weeks.
You love it?
I love it.
Patients love it?
Yeah.
They love you?
We'll see. I don't know.
Ali, it's super pleasure.
Very nice to meet you.
Really great to meet you.
Yeah,
Oh,
take
thanks
care.
so much.
Thank you very much.
All right.